on the web, and in your hands. This is MDiTV.
This particular turf war goes back more than 30 years to the first angioplasty. That's the procedure cardiologists use to reopen a blood vessel from the inside using a balloon-tipped catheter. Before that, a bypass operation done by a cardiac surgeon was the only way to really fix a blocked artery and restore blood flow to the muscle of the heart. The latest battle action report suggests the cardiologist may be taking patients that might be better off with a surgeon.
Given that it's their daily bread and butter, and unless there's a scenario where you have an indication for bypass surgery that's so overwhelming, I think you will always find skewed results.
That's New York cardiologist Dr. Olivier Frankenberger reacting to a study that reviewed the treatment advice dispensed by interventional cardiologists and compared it to guidelines issued by the American College of Cardiology and the American Heart Association. Researchers at the University of Albany used a New York State database that included records on more than 16,000 patients with coronary artery disease who were treated at 19 different hospitals. They wanted to know how often the cardiologists referred patients to a cardiac surgeon and how often they decided to do angioplasty treatment themselves. According to the research that was published in the journal Circulation, of the patients who, according to the guidelines, should probably have had a bypass operation, only about half were actually referred on to a surgeon. For many patients, either angioplasty or surgery can be a reasonable choice. But the recommendations of cardiologists were lopsided. They kept 95% of those patients for themselves. Although Dr. Frankenberger is a cardiologist, he admits the study's findings about how his fellow cardiologists behave have a ring of truth.
I think the main issue is really that the way the typical flow of patients through the hospital is, you're left with the interventional cardiologist. That's
because so many patients can be helped by either angioplasty or bypass surgery, cardiologist Michael Wilson says the choice isn't always clear-cut.
There's a lot of gray zones in these patients, and the decision to send someone to surgery or do angioplasty is a complex decision.
The decision may be complex, but it's often made quickly and often without consulting a surgeon. Dr. Wilson explains that in many cases, a cardiologist can do the diagnosis of coronary artery blockage and then treat it all during the same session.
We can offer them that to trust us and say that we kind of know you now, we know what symptoms you have, what stress test results we have, and when we go in to do our angiogram, we're going to make the best decision we can based on our experience, and we would will then try to fix it. So when you leave the room, you're taken care of. When you make an offer to a patient like that, I think you would find that 9 times out of 10, they would prefer to have a single procedure.
And then many patients just don't want to undergo surgery, even if the evidence indicates it's just as good as angioplasty or maybe even better in certain cases. Dr. Frankenberger offers an additional explanation. When patients are diagnosed, it is, after all, usually by a cardiologist.
I think it's a cultural result that even though cardiologists and cardiothoracic surgeons work together, they still fight their own turf battles.
An editorial that also appeared in the journal Circulation noted that although part of the explanation may be that cardiologists honestly believe that what the guidelines recommend isn't always the best choice for their particular patients, a darker explanation cannot be ignored. A grow the business mentality that allows the self-interest of cardiologists to influence their recommendations. And the editorial warns, if cardiologists aren't careful, their apparent dominance in this turf war of angioplasty versus bypass surgery could trigger a counterattack, perhaps including mandatory reviews of the treatments they recommend to their patients.